Hi, my name is Dr. Robert Groysman from covidinstitute.org, and today I want to discuss dysautonomia, what it is, the symptoms of it, and how to treat it, and especially how it fits into long COVID. What is dysautonomia? It's a combination of several medical conditions that cause dysfunction of the autonomic nervous system. Now, the autonomic nervous system is responsible for regulating many of the involuntary bodily functions, such as heart rate, blood pressure, digestion, temperature control. And it could be a primary condition, such as in POTS. POTS is an actual condition that causes dysautonomia, or it could be congenital or secondary to a medical condition or infection. So there's a disruption of the autonomic nervous system, the way it functions. And this leads to a lot of problems with regulating various bodily processes. The symptoms can vary, and many times there could be issues depending on the individual, and the symptoms can be very different from person to person. What type of forms of dysautonomia are there? Well, there's POTS, as we mentioned. There's vasovagal syncope, which is also known as cardiogenic syncope, and orthostatic hypotension. So, again, what is dysautonomia? It's damage or inflammation to part or all of the autonomic nervous system. The damage or inflammation can be localized to a small area, or it can be generalized and widespread. What is the autonomic nervous system? It is composed of essentially two parts. One is the sympathetic nervous system, which we'll refer to as SNS, and the parasympathetic nervous system, which we'll refer to as PNS. There's also the myenteric plexus, which mainly controls the gut. It gets input from both, but the vagus nerve is responsible for a lot of what happens in the gut through this myenteric plexus. So let's look at what it looks like. The parasympathetic division causes your pupils to constrict, causes you to salivate, causes your airways to constrict, slows your heart rate, lets your stomach digest. That includes secretion of acid and bile and other enzymes from your pancreas. It allows your intestines to digest. It constricts your bladder, so this makes you pee. And reproductive system increases blood flow, so we're talking about things like erection. The sympathetic division does the opposite. It causes your pupils to dilate. It causes saliva to dry out or be inhibited, so you're not producing it. It causes your airways to dilate. It increases your heart rate. It inhibits digestion. It causes your liver to release glucose. This is all part of glucagon and release of glucose. It stops digestion. It causes adrenaline to be released. It's really not kidneys. It should really be adrenal glands. The bladder relaxes. You don't want to pee here. And it obviously does the opposite of the parasympathetic here and decreases blood flow. So now that we know what these two divisions do, let's look at some of the dysautonomia symptoms. So, orthostatic intolerance. So, what exactly is orthostatic intolerance? It does not mean orthostatic hypotension. It just means that when you're standing up, when you're upright, you start feeling symptoms of lightheadedness, dizziness. You feel like you're going to pass out, or you do pass out, and you feel unsteady. That's what orthostatic intolerance is. This could be due to blood pressure, or it could be due to heart rate, if it's beating either too fast or too slow. Tachycardia. It's a fast heartbeat. This is often felt as palpitations. Hypotension. Again, the low blood pressure would cause dizziness, blurred vision, feeling like you're going to faint, or feeling weak. Gastrointestinal issues. These are going to be issues like nausea, vomiting, bloating, abdominal pain, constipation, or diarrhea. Temperature regulation issues. Now, this can go one of two ways. This can go to inappropriate sweating or over sweating excess, called hyperhidrosis, or it can go the other way and have lack of sweating and hydrosis. Fatigue and exercise intolerance kind of go together. This would be chronic fatigue, decreased stamina, and difficulty with doing any physical exertion. Sleep disorders, having a disrupted sleep pattern, insomnia, or even excessive sleepiness. You can have both. Cognitive and emotional symptoms, executive functions, brain fog, and mood fluctuations. This includes things like anxiety and depression as well. Urinary and sexual dysfunction, well, problems with bladder control. Some people have urinary retention, inability to empty their bladder, and some have incontinence, inability to stop urinating or going frequently. And of course, there's sexual dysfunction, including erectile dysfunction. Vision and hearing changes, things like blurred vision, sensitivity to light, called photophobia, ringing in the ears, people are familiar with this, tinnitus, or changes in hearing. So these are some of the symptoms that you can see with dysautonomia. What conditions cause dysautonomia? So very common diabetes mellitus. One or two can cause dysautonomia. Now remember, each of these conditions, each of these diseases or infections can damage or inflame your autonomic nervous system. That may not be all they do. They may attack other parts of the nervous system, but at the very minimum, they would have an effect on the autonomic nervous system, which could be one or the other or both. That is, the SNS, the PNS, or both of them. So diabetes mellitus, chronic alcoholism will do it, amyloidosis, and this is a buildup of amyloid protein in various organs, and that includes the nervous system, including the ANS. Lupus, which is an autoimmune condition where your body is attacking itself by producing autoantibodies. Parkinson's disease and Lewy body dementia should be kind of mentioned together. They often occur together. Sometimes Parkinson's occurs separately outside the Lewy body. Ehlers-Danlos or EDS and hypermobility spectrum disorders. These can also damage the autonomic nervous system. This is surprising, right? Low vitamin D. Low vitamin D can lead to dysautonomia. Okay, let's talk about infections. HIV, the herpes family viruses, which is Epstein-Barr, varicella zoster, CMV, Lyme disease, Chagas disease, not very common in the States, more common in Latin countries. It's transmitted by a tick, leprosy. Rabies, if you have rabies, you probably have other problems than dysautonomia. Um, and toxins from tetanus, botulism, and diphtheria. And lastly, but uh, not least important, is COVID. COVID 19 causes dysautonomia. This has been shown multiple times. What is POTS? So, POTS is a condition that's primary that's causing dysautonomia. So, you'll notice that a lot of the symptoms are going to be the same as we discussed in dysautonomia. What is the hallmark of POTS? Well, it's heart rate. It's the rapid heart rate, okay? There are ways to test for it, which we'll go over in the next few slides. So tachycardia, orthostatic intolerance, these are kind of hallmarks, but you also see other symptoms like fatigue, palpitations, exercise intolerance, cognitive and mental health symptoms, gastrointestinal issues, headaches, sleep disturbances, and temperature regulation issues. What is CFS? Chronic fatigue syndrome, also known as myalgic encephalomyelitis. Now, this one also causes dysautonomia, but the hallmark of CFS is the chronic fatigue, the persistent chronic fatigue that's lasted 6 months or longer and is not relieved by rest or sleep. And if you notice, again, most of the symptoms match. Persistent fatigue, cognitive difficulties, sleep disturbances, post-exertional malaise tends to be associated with CFS more so than with POTS or general dysautonomia. Muscle and joint pain, headaches, sore throat, and tender lymph nodes. And this is more likely due to the fact that chronic fatigue is often associated with Epstein-Barr virus, digestive issues, sensitivities to light, foods, medications, and different stimuli. So if you've had this with long COVID, you kind of know what's causing it. And psychological symptoms, that would be anxiety, depression, mood swings, irritability, and so forth. Do you notice anything similar between chronic fatigue syndrome, dysautonomia, and POTS, and even long COVID? Well, they all share a very similar symptom pattern. Even though they may have a prominence in one or the other, there's still a similarity between all of them. They all have cognitive function problems, including executive function, including brain fog. They all have sleep disturbance issues, chronic fatigue, post exertional malaise, anxiety and depression, and digestive problems. How do you test for POTS and orthostatic hypotension? So, what's important to know is that they are mutually exclusive. POTS is just a milder form of orthostatic hypotension. They can't exist at the same time. You can't have them both. If you have one, you don't have the other. So the main way to do this is with a tilt table test. There's other ways where you can just lay down and then stand up and check your blood pressure and heart rate without using a tilt table. But what we're looking for to diagnose orthostatic hypotension is the systolic number, which is the top number of your blood pressure, to drop more than 20 or 20 millimeters of mercury, and or the diastolic number, which is the bottom number, to drop 10 millimeters of mercury or more, and that it occurs within the first 3 minutes or so of standing. That is considered a positive test for orthostatic hypotension. In POTS, this won't happen. So when you stand up from a laying down position, you're going to see an increase in heart rate by at least 30 beats per minute, or 40 if it's an adolescent. And what you're looking for is this to happen within the first 10 minutes of standing. Now, this may happen together with the blood pressure drop. If this happens, it's still orthostatic hypotension, not POTS. But if the blood pressure does not drop, only the heart rate increases, that's POTS. Now, there's other tests that can be used to confirm dysautonomia. One is heart rate variability. That is the measurement between each beat of the heart, not the heart rate, but the changes between beats, usually measured in milliseconds. Deep breathing test. This can also evaluate autonomic control. We're checking your heart rate variability during this maneuver. Sweat tests. This looks at how you respond to different stimulation and temperature changes from sweat production. So there's no direct way to measure autonomic nervous system function or dysfunction. So these tests measure it indirectly by looking at heart rate variability, blood pressure, and sweat. Those are the main things. Valsalva maneuver, again, looks at heart rate changes based on increasing the resistance while breathing. And there's quantitative pseudomotor axon reflex test, or QSART. And again, this looks at sweat production in response to an electrical stimulation. How do you treat dysautonomia? This is what most people want to know. Well, we talked about some of the causes. So if it's possible, treat the cause. If you treat the cause, chances are that the dysautonomia will also dissipate. You can increase hydration, which means fluids, and salt intake. This can be done orally, or it could be done intravenously, like through an IV drip. Just normal saline is plenty. Compression garments. This would be in the lower half of the body. Medications that help decrease the heart rate. Well, beta blockers and calcium channel blockers are the usual go-tos. But they don't just decrease the heart rate, they also decrease the force of the heart pumping. Corlinor is a new medication, has a new class of medication that only works on the sinoatrial node, the SA node, the pacemaker of the heart. It basically slows that down without affecting other parts of the heart. Midodrine is a vasoconstrictor. Now, this is mainly used for orthostatic hypotension, but it can also be used in POTS as well. Fluticasone helps retain salt. It's a mineral corticoid, a steroid, um, and it helps increase blood volume because it retains the salt. Pyridostigmine or mestinon can slow the heart rate down as well. Avoiding foods that trigger your symptoms. Some people are triggered by certain foods. Physical therapy or exercise. And of course, there's the stellate ganglion block and vagus nerve stimulation. This can help as well with dysautonomia. This is the end of our presentation. I hope you enjoyed it. Don't forget to like. That encourages me to make more videos. And visit us on covidinstitute.com. I'm sorry, .com works too, or covidinstitute.org. And check us out on the Facebook group. Everything is listed in the description. Thank you.